So how do you decide whether to do a mock-up in composite resin or to do a wax-up in the lab? If you try to do things that are beyond the ability of yourself or your technician, particularly with some of the new techniques that are very, very trendy on Facebook, you will get a very trendy case that's a failure. The thing we want to know is, as the teeth have worn, have they erupted to compensate? Has the gum come down with the tooth as you've been wearing the tooth down? A simple test for this is if you add length onto the tooth, okay, and the patient looks like a rabbit, then you have compensatory eruption. I definitely would not do a bonded restoration for this particular case. Something that I've learned over a long period of time with dentistry is that if something looks right, it usually is right. Our patients most of the time can't tell that the gum line is not perfect because they never know until we tell them things like, you know, high, low, high, high, low, high. Gingival heights of the teeth should be high on the canines, then low, high, high, low, high. The decision about what we do on the upper versus the lower is very much the patient wants stuff that looks good for a long time, but she can't afford to do everything, so how are we going to save money? Composite resin on the lowers. As always with anterior work, you should strip out everything. So don't put new work over old dentistry unless you did the dentistry recently and you know it's good. You etch all the teeth, bond them all, and then you put composite on the whole lower arch or the lower anterior teeth all at once with no matrix. Part of the reason we do fancy treatments is because we're a bit bored, okay? We've done it over and over again. We know that we can achieve it if we do it the old-fashioned way, and so we want to learn something new. The